Muy buenos días a todos los que se están conectando en este momento. Ya tenemos más de 60 conectados a nuestro
Good
webinar.
morning to all our attendees
Y yo creo
to
que en
this
aras de la confianza,
session.
porque tenemos una agenda muy robusta,
And
quisiera poder
for purposes of time, and
empezar
because we have
este
a
webinar. Lo
robust
primero
agenda
es
for today,
darles a
I would like
todos
to
una
start off
muy,
with
muy
this
cordial
webinar. The
bienvenida
first thing
a
is to
este webinar que hemos
welcome you all
organizado entre
warmly
FIFARMA y
to
la
this
Universidad de
webinar
São
that we
Paulo.
have organized between
Teníamos
FIFARMA and the
muchas ganas de
University
hacer
of
este
São
webinar hace
Paulo.
ya
We
varios
wanted to
meses y
hold this
estamos listos
session several
para
months
poder estar aquí
ago,
presentes y
and
poder
now
dar
we're
mensajes que
ready
son tan,
to
tan,
be
tan
able to
importantes para la
start
región.
sending
Para
all
hoy,
these
de
messages that are
manera
so important
demostrativa,
for our
tenemos
region. For
traducción
today,
simultánea
we
a los
have
tres idiomas
simultaneous
de FIFARMA:
interpretation to the
español,
three
portugués e
languages
inglés.
of FIFARMA,
Cada uno
Spanish,
puede ir
Portuguese,
escogiendo
and
cuál
English.
será el
Each of
idioma de
you
su
can
preferencia
start
en el día de hoy para poder
choosing what your
escuchar
preferred
este
language
webinar.
will
Mi
be
nombre es
to
Janet
listen to
Gija,
this
soy la
webinar.
directora
My
técnica
name
de
is
FIFARMA,
Janet
la
Gija. I'm the
Federación
Executive
Latinoamericana de la
Director of
Industria
FIFARMA,
Farmacéutica de
Latin
Investigación y
American
Desarrollo.
Federation of the
Nosotros como FIFARMA
Pharmaceutical
reunimos
Industry
a
for Research and
18
Development. At
compañías
FIFARMA,
de
we
investigación
gather
y desarrollo
18
y a
companies of
11
research and
asociaciones
development and
locales. Es decir,
11
esas organizaciones
local
que en cada
associations.
país
These
de la región
associations
representan también a la
which
industria. Tenemos el
represent the
gran
industry
honor,
in
pero
each
también la gran
country. We have the
responsabilidad
great
de
honor, but
trabajar
also
con
the great
otros actores de la
responsibility of
región
working with
para
other
poder
actors around the
promover
region
mejores sistemas
to
de salud e
promote
innovación.
better
Trabajamos con el
healthcare
bienestar, la
systems and
seguridad de la salud,
innovation. We
nos
work
toca a
for
todos
well-being.
los que estamos aquí
This is
presentes y seguramente a
something
muchos
that
más que
is
hoy tal
for
vez no están presentes.
all of
Una de
us,
las áreas
those of us who are here and
que nos
those of us who
enfocamos en
may not be
FIFARMA
here
es la
today.
que hemos
One
denominado salud como
area
inversión,
that we
que
focus
es
on
el
in
efecto del
at
trabajo
FIFARMA
de
is what we have
extracción.
called health
Creemos que todo lo que
with
se invierte en salud,
investment. We
cada
believe
cosa que se haga en los
that
temas de salud,
everything that
que
is
se invierta
invested in
en
health,
recursos
that
humanos,
everything that
físicos y
is
financieros,
invested in
tiene un
human,
impacto
physical,
no
and
solamente en el
financial
bienestar
resources
de los
has an
habitantes de
impact
la
not
región,
only
también
in
nos
the
generará
well-being of
en
the
el
region's
desarrollo económico y
inhabitants,
la
but it will
productividad
also
de
have an
nuestros
impact in
países.
economic
Por eso
development
nos aliamos con la
and our
Universidad de São
country's
Paulo para
productivity.
explorar en
That is why we
detalle
have
esta
entered into an
inversión en
alliance with the
equipo de
University of
salud
São
en
Paulo to
6
look
países de la
at the
región: Brasil,
funding
México,
of six
Argentina,
countries in the
Colombia,
region
Chile y
in
Perú.
terms of
Como
healthcare.
siempre, y es lo que siempre decimos en FIFARMA, estos
As
estudios
we
son
always
un
say in
punto de
FIFARMA, these
partida.
studies
Estos
are
estudios
just a
son
starting
datos e
point.
información
This
útil y
is
valiosa que nos ayudan
data
a
and
organizar
useful and
y nos permiten
valuable
sentarnos a
information,
conversar,
organized information
sentarnos a
that
tener conversaciones
enables us
mucho
to
mejor
start
informadas
having
para poder
much
encontrar
better
vías de
informed
solución,
conversations
vías de
to be
creación
able
y,
to
por qué no,
find
también vías de
pathways
innovación.
of
A continuación
creation
les voy
and
a explicar
also
un poco de cómo
innovation.
está
I will
estructurada la
now
dinámica de este
explain
webinar.
how
Vamos a
this
iniciar
webinar has
con
been
la presentación del
structured.
estudio a cargo del profesor Pedro
We will
Dalari,
be
que
starting
es
with the
decano y
presentation of the
estatuto de
study
Relaciones
by
Internacionales de
Pedro
la Universidad de Sao Paulo, quien
Dallari,
ha
the
sido
Dean of the
gran
Institute of
aliado
Research at the
en este
University
tema.
of Sao
Profesor
Paulo, who
Dalari
has been
tiene
a
una
great
trayectoria
ally.
impresionante y
He
hoy
has
nos
great
contará
track
qué es lo que ha
record,
venido haciendo en este estudio, que fue un
and today
estudio que
he will
nació
be
a partir de
telling
una
us
conversación
about
que tuvimos hace un
this
par de años
study.
en
This
Sao Paulo
study
y que
stemmed
hoy
from a
estamos
conversation that
materializando
we
a
had two
través
years
de
ago in
ese
Sao
estudio, que
Paulo,
ya está
and now
disponible
we're
en la página web
materializing,
de FIFARMA, y también tenemos
and it
otras
is
fuentes de
available
del mismo
at
estudio.
the
Lo van a
FIFARMA
acompañar, después de
website.
su presentación, dos
After his
investigadoras,
presentation, there
en
will
este caso la doctora
be two
Marisley Disijima, quien
researchers,
presentará
Dr.
los
Marisley
hallazgos para
Disijima,
Brasil, y la
who
doctora
will
María Antonieta
present
Links,
our
que
findings
expondrá los
for
resultados
Brazil,
de
and Maria
México.
Antonieta
Nos hubiera
Links, who
encantado poder
will
tener
be
todos los
presenting
países aquí,
the
pero el tiempo
results for
no lo
Mexico. We
logramos,
would have loved to
pero
have
les
all the
dije hace un
countries.
momento, el estudio está
For
disponible para
time,
que
we were
todos
not able
lo
to,
podamos
but
revisar
as I
y
told you,
podamos
the study
explorar
is available
básicamente los
for all
principales
of us to
hallazgos para
review
cada
and to
Después de la presentación del
check
estudio,
the main
del doctor Pedro
findings
Dalari y
for
de
each
nuestras
country.
investigadoras
After the
invitadas,
presentation of the
tendremos
study,
un panel que hemos denominado la
we will have a
importancia de la inversión en
panel
salud.
that we have
Y este
called
panel será
the
moderado por
importance
el
of
doctor Alejandro
healthcare
Penagos.
investment.
Pronto
This
me van a
panel will be
regañar por
moderated
decirle
by
doctor, pero por Alejandro
Dr.
Penagos.
Alejandro Penagos.
Alejandro es el
Well,
co-líder del
he may
Comité
not
para el
like that I
Trabajo
call
de
him
Acceso
doctor.
e
So
Innovación de
he
FIFARMA
is a
y director
co-leader of
de
the
Soluciones
FIFARMA
Innovadoras de Acceso y
Access and
Políticas para
Innovation Group and
Latinoamérica,
Director
Canadá
of
y
Access and
Novartis.
Policies for
En
Latin
este
America and
panel
Canada
tendremos también las
at
intervenciones
Novartis.
de Horacio Toro,
In this
exdirector
panel, we
nacional de
will
salud
also
de
have
Costa
interventions
Rica
from
de América
Horacio
Latina,
Toro,
Kenji López, presidente de la
Kenji
Fundación Cancer Warriors
Lopez,
de México,
president of the
y
Cancer Warriors
ahondaremos
Foundation
también
in Mexico,
en
and we
mucho de lo
will
que tiene que ver con el
also
rol
deepen
de la
on
academia en este
the
frente con el doctor
role of the
Guillermo Aponte,
academia here
quien ha sido también
with
parte muy,
Dr.
muy
Guillermo Aponte, which he has been a very active part of this work and this research from the beginning. Thank you all for participating. Thank you all for giving us your time, and all of you who will be here with us today as speakers. But I also want to thank those that are uh, attending and accompanying us today, because this is something that should really bring us all together, and something that we need to continue working on and insisting on constantly. I am convinced that in persistence lie the outcomes of everything that we want to do in life, and this surely merits a persistence and the discipline And now I will hand the floor to Mr. Pedro Dalaris to start his presentation. Pedro. Thank you very much, Janet. It is a great pleasure to be able to participate in this session. 2 years after we started the conversation on the more effective work. I will use my 15 minutes to talk about two things, about the project and the project outcome of the project result and the book. I am a dean and tenured professor at the International Relations Institute at the São Paulo University, one of the 50 units of schools, museums of the University of São Paulo, which is a public university in Brazil. It has 97,000 students, 6,000 professors, and it is the largest university in Brazil, along with other universities of Ibero-America. It holds a high position in international rankings. The USP FIFARMA research agreement was entered into in February 2023, following the initial conversations in September 2022 with Diana. And thus was determined in the work plan. The purpose of the project is the development of qualitative and quantitative investigation about the topic of healthcare as investment in 6 countries in Latin America, identifying the causes and current status of health expenditure and promoting arguments to consolidate a narrative that sees health as an investment and not as a cost. The countries selected are Brazil, Mexico, Colombia, Argentina, Peru, and Chile. Next, please. The project came from a research agreement signed in February 2023 between USP and FIFARMA and the USP Support Foundation. FIFARMA was responsible for financial support and methodological orientation, and the research work was done by 8 researchers from São Paulo University, and the USP dealt with the administration of the agreement. Next. How was the work done? 6 professors from the economics area in São Paulo University developed research activities and produced careful analysis on the financing of the healthcare services in the countries studied: Argentina, Brazil, Chile, Colombia, Mexico, and Peru. Both coordinators, myself and Professor Guillermo Aponte, who is here with us today also, developed broader themed studies. Guillermo conducted a study on the demographic environment of healthcare in Latin America, and I did a study on the constitutional frameworks to guarantee the implementation of the right to health in Latin America. Next. How was the work done? The drafting of the 6 articles and the introductory articles and the specific articles followed a methodology that was jointly defined by USP and FIFARMA, based on the formal and subtractive guidelines established in the terms of reference for the research. USP and FIFARMA jointly defined some terms of reference with the objectives, the items, and the work structure. And the 8 researchers from the USP produced a first version of each article and presented it to the FIFARMA experts. This around late last year. After a deep analysis conducted by these FIFARMA experts, their observations were conveyed by FIFARMA to 2 researchers who revised the texts and produced the final version of each of the texts. This is very important. And finally, we produced a sort of book and with the consolidation of all documents. You can access it through the QR code on the website of the International Relations Institute. But as Janet said, it is also accessible through other channels.
¿Perdimos a Pedro? Sí.
Have we lost Pedro? It seems that we've lost Pedro.
No siempre tenemos la conexión de internet perfecta.
We don't always have the best internet connection. Let's wait until Pedro can log in again. I think he was telling us that you can download the QR for the study. Also, as I said in my intervention, it is available at the FIFARMA website. This is an extensive study that wherever there was a brief interruption. I'm back. Go ahead, Pedro. I was just telling them about the QR and the fact that it's available on the website and the executive summary too. So the QR worked? Has anyone managed to use the QR? Okay, you tell me. Next. It worked, good. What is the book structure? And this is the index and or the table of contents rather, and there's some information about the authors at the beginning, so you can have some of the history of each of the 8 of us. Then a brief introduction, and we start with the article from Guillermo Aponte, Demographic and Economic Environment of Healthcare in Latin America, following by a paper or an article by myself, Constitutional Framework to Guarantee and Implement Healthcare in Latin America, based on the constitutional law of the 6 countries, trying to find the main points from a legal standpoint in relation to this topic. Here we have the 6 texts that, as I was telling you, are following a specific methodology of a terms of reference that were prepared by USP and FIFARMA, but each is an authored text on Argentina, Brazil, Chile, Colombia, Mexico, and Peru. Professors Daniela, Marislene, Natalia, Adriana, Maria Antonieta are economics professors of the International Relations Institute. Professor Flavia is an economics professor of another institution of the USP, the Human Sciences and Arts School. Each of them worked on the analysis of a country. Next, please. And finally, there's an article with some final considerations from myself and Guillermo. These general considerations, or final general considerations, I believe are important in this final part of my presentation to share with you. Here, conduct an analysis based on the demographic and economic environment. We have some considerations on healthcare as an investment, governance of the system, inequitable access to pension, financial resources allocated to health, and public and private funding sources, out-of-pocket expenses, and other challenges that must be faced to achieve healthcare with no discrimination. In the final general considerations, there's a systematization of the main data obtained from each of the studies in each of the 6 countries about these items: healthcare as investment, system structure and governance, access to healthcare, universal coverage, sources of funding, public expenditure, and private expenditure. So each of this, we quickly systematize the main information and individual studies to be able to compare and get some general overall results. And finally, what I believe is an even more interesting proposal is that there are some challenges that are posed based on the findings of the study. These are 10 challenges, but I have selected some. The first one is the political will to fight the reduction of out-of-pocket expenses by the population through the adequate allocation and execution of public budget assigned to health. There are still a lot of out-of-pocket expenses, which is an issue in the effective financing of healthcare. Out-of-pocket against family expenditure reflects a financial barrier for access to healthcare, which is greater the lower the income that is perceived by a vulnerable sector of the population. Yet another example, can you pass the slide, please? It is important to allocate budget and implement actions to ensure that the population has access to quality essential medications and policies to fight forgery and ensure the authenticity of medications. This is a serious problem that was identified in the different countries. The cost of medication and the risk of forgery, and there's a need to guarantee security. The next consideration is income distribution has a significant impact in access to health care. If there's inequality in the distribution of the income, the low-income persons will have a difficulty in paying their services, healthcare services, co-payments, medical treatments, or devices. This brings in inequities in medical attention. This is a chronic problem in Latin America, which is social inequity or inequality. Social inequality has several. I can say that in healthcare, this is seen even more than from out-of-pocket and private expenditure, and in uses as significant as the means of financing of healthcare services. And finally, healthcare investment must consider a global demographic characteristic that is increasingly important, and the region is no exception. The aging population, which is increasing the demand for healthcare services, particularly for chronic disease and long-term care. Recent information suggests that the acceleration of the process of reduction of the population and the aging of the population is becoming even more accelerated than was thought some time ago. And this, of course, has an impact in healthcare. My time is running out, and therefore I would like to just state that this was the work, a general legal scenario on Latin America, followed by the targeted studies for each of the 6 countries studied. And despite the fact that these studies are authored, and there's a methodology that causes that all 6 studies are working on the same points in order to consider a comparison or a conclusion as final general conclusions. And the book is laid out in a very specific manner, in such a way that the interested parties can go directly to the points that they're interested on. It is not a book that is read as a novel. It is precisely a book that has the possibility of going and targeting specific points. And the sequence, the Professor Marisley Nishijima will be talking a little bit about Brazil, and Maria Antonieta about Mexico. Which of them has 5 minutes? For an academic, 5 minutes are not enough to say good morning even. It's very little time. And of course, they're not going to give us a presentation. They're just going to talk about 1 or 2 points that are important to be considered in the study. I invite each of you to read this work, which is very interesting and which is a contribution that makes University of São Paulo very happy to be able to participate in this such rich cooperation with FIFARMA, and this has been extraordinary from all possible standpoints. Well, I believe that I have fulfilled my assigned time in rigor. Thank you, Professor. Thank you, Pedro, for telling us about how the process was, first of all, and then how this study and this book is structured, which undoubtedly will be very useful for all of us. And as I was telling you just a moment ago, we have an executive summary because the study is extensive, is very extensive, but there's also an executive summary for you to be able to check figures, charts. Before handing the floor to Professor Marisley and then Professor Maria Antonieta, I just want to tell you a couple of very important messages. Let's remember the gap that we have with the more advanced countries. The Latin American country that invests the most in the healthcare, which is Brazil, invests less than the European country that invests the less, which is Portugal. So we can see the dimension of the issue at hand, and then all the challenges start. No Latin American country, well, maybe with the most recent figures, there are a couple of countries that do make it, but none have reached this 6% of public expenditure on healthcare. Very few have achieved it, and we still have a big gap there. And I want to issue a very special call to countries such as Mexico and Peru, where we have very low investment, even way below the regional average. So this is some messages that we need to continue reinforcing, and we need to continue adding not only data and studies, but also more communication too. Professor Marisley, I know that you have some slides. Let's remember that we have simultaneous interpretation if you want to listen to Marisley in another language. She is going to speak in Portuguese.
Olá, eu vou começar aqui agradecendo pela participação, dizendo que eu estou muito feliz de estar aqui para apresentar esse trabalho.
I want to thank you for having me. I'm very happy to be here to present this work. And I'm going to start the presentation talking about Brazil. Can we move on to the next slide, please?
Eu queria dizer para vocês o seguinte. O Brasil tem sistema de saúde público que é considerado
Well, I wanted to tell you the following. Brazil has a public healthcare system that is considered to be an international model. It stems from the 1988 Constitution, and since then, we progressively started to implement the policies associated with the system and the financing of it. However, after 2015, this system, which was being implemented, had a pause or a reversal in its implementation due to political changes or more conservative governments, and there was a significant reduction of healthcare expenditure and also an initiative for privatization of the healthcare sector. All this gave rise to restrictions in access. Could we move on to the next slide, please? And what happened is that there was this change in the private sector, and I wanted to make this observation that it tends to 25% of the population, and This is also related to dental care. However, the issue is that with these changes and this new policy that activated the privatization and the reduction of the state to reduce public expenditure, what happened actually was that there was a flaw in the system. And the private system is being financed by public money. Can we move on to the next slide? And I will show you some of the challenges. The first challenge is increasing resources for the public sector, considering that we have a reduction in income because of the COVID pandemic. We went through a time of recession, and it was a difficulty for us. And another difficulty that we have in Brazil is that we need to correct the diversion of resources to the private sector. And there's no problem with this, but they need to be redirected. We need to correct that. With this new government, which was elected in 2022, we're working to reverse to change this reversal of the funds. But as I was telling you, the diminishing resources because of the recession that we're going through after the COVID pandemic, and because some of the actions were also reversed, and we know that reverting them back is increasingly harder. Well, that's the issue that we're going through in Brazil right now. Brazil spends 4% of the GDP in healthcare. We're still below average. But we hope that we'll be able to reach the average. I'm sorry, I think that we failed to introduce you, but it's been an honor. It would have been great to have all the researchers today, and time was not enough, so we wanted to focus particularly on Brazil and Mexico. So thank you, Doctor and Dr. Maria Antonieta, you have the floor. Good morning, ladies and gentlemen. It's a pleasure for me to be here also and be able to present our research. And it's also a pleasure to listen to other countries and know about their situations. I'm particularly very interested in Mexico. I've studied another sector in Mexico, the financial sector. Well, in 2 words, 5 minutes to try to present the system is, I would say that the Mexican healthcare system is comprised of a complex structure of institutions and rules. Among the political priorities of the state, there is always achieving the universal healthcare coverage, which shows or the long series of reforms that it has suffered. To talk about mental health, we need to talk about several things. One is the institutional complexity with separate bodies that attend to different groups depending on their position in the labor market, and to the fact that the universal coverage objective has not been achieved. This entails the formulation of a relevant question that has not yet been addressed in this research, which is to what extent institutional reforms have been successful in their undertakings. Health expenditure must be considered as an investment and not as ordinary expenses or current expenses. Governments must ensure equitable access to healthcare systems and quality healthcare for all citizens. In that sense, the implementation of the transformation of the public healthcare system in Mexico calls for a multi-stakeholder response. Innovation and development in policies and training of the human capital and dialogue among the private and public sectors, NGOs, and civil society. Indicators related to public expenditure and coverage of the system and the healthcare conditions of the country show that there has been undeniable progress in the last 20 years. However, despite the constant transformations, the system continues to be fragmented and does not yet reach the coverage of the most at-need groups in the population. The information that was gathered in the research shows an effective growth of public expenditure in these 20 years, which indicates a higher priority given to this area from the government side, which is also verified by the institutional changes. In Mexico, the prioritized areas for healthcare expenditure are access to medications, actions to guarantee that they are good quality and they reach the population that needs them, medical attention, and health prevention and promotion, structure of the human capital, which involves expenses like equipment of the hospitals and health posts, and finally, research and development for innovation in health. The current expense in healthcare as a proportion of the GDP went from 4% at the beginning of this millennium to 6.5% 2 decades later. But when we look at the information in dollars, the increase in expenditure seems to be much more significant. For an inflation of around 140% in Mexico during that term of 20 years, per capita expenditure of the government grew in nominal terms around 470%, and private expenditure grew by 320%, whereas out-of-pocket expenditures increased only by 24%. Although this upward trend is seen, the compared magnitude to other Latin American countries show that expenditure in Mexico is way lower than in other economies, as well as than the region average. In 2020, the first year of the COVID-19 pandemic, for an average expenditure of 8.7 in Latin America, Mexico spent 6.2%, whereas Argentina, Brazil, and Chile had an expenditure of 10%. To lay out a general chart of the expenditure, we can see the information in dollars. From all this, my conclusions, or our conclusions are, first, the numerous reforms that continue to occur in Mexico and in the sector have not been able to resolve its main characteristic, which is the fragmentation and the complexity of the system. The system stems from the idea of granting subsidies and creating structures for differential attention according to the population attended to, which leads us to wondering to what extent this structure has not been in itself an obstacle to the achievement of the main objective, which is the universal coverage. There is a large number of institutions that provide compartmented service to different population groups, which are segmented mainly based on how they are faring in the labor market. In the formal market, it benefits really from the structure of the system, when informal workers are kept aside. And there's also an issue with the inequity and inequalities in the geographical distribution of healthcare, which mainly affects lower income sectors and those that are farther away from urban centers. Mexico, and I'll repeat that the comparison with other countries in the region indicates that Mexico is still spending relatively less in healthcare. There was an improvement, but the vaccination coverage, and with this improvement, we can verify that the vaccination coverage increased significantly. It is close to becoming universal. And finally, the physical and human resources for healthcare grew modestly in this data, in this term. So, thank you very much. And once again, I would like to highlight the importance of understanding healthcare expenditure as an investment and not as ordinary expenses. Thank you very much. Thank you, Dr. Maria Antonieta, Dr. Marisley, Pedro Dalai. And now we have a space that I believe will be very important in this session, in this webinar, which is more for talking. I believe we have highlighted some of the findings of the study. We have raised the message that I believe we all have repeated. It's necessary to invest in health. It's not about spending in health, but investing. Whatever we do has an impact, of course, in the well-being of the population, but also in the economic and productive development of our countries and our societies. So with this, and following these interventions, I will now hand the floor to Alejandro Penagos. Alejandro Penagos is a leader of the Access and Innovation Group in FIFARMA, and I believe he has a very special space for us in this session. We have had over 100 people connected all the time, which is great, and I believe this is going to be recorded. And for those who just logged in, you should know that the studies are available on the website. They have told me that the QR has been deactivated for now, but they are available on the website. Alejandra, you have the floor now to continue moderating this great panel that we have. Thank you, Janet. Thank you all. Truly a privilege to be here. As Janet mentioned, I am the co-chair of the Access Innovation team at FIFARMA and Direction of Innovation and Access and Policies, Access Policies for Novartis. And I want to thank FIFARMA for the invitation to talk today. I would like to open this panel by recapping on 3 concrete messages that stem from this interesting research done by São Paulo University. First key message: allocating funds in health is an investment and not an expenditure. In fact, the financial resources destined to the care and prevention in health is an investment that contributes to the economic growth of countries. For instance, improving the life quality of the population, or improving learning capabilities, job skills, or even improving healthy life expectancy. The second message is that economic growth in Latin America undoubtedly is directly related to the level of investment in health. As an example of this, we can see the result of the financing chapter in Argentina, done by Daniela Schettini, who is joining us today, where she says that an improvement of 10% in life expectancy is associated with an increase of 0.3 to 0.4 in economic growth per year. These are very powerful figures. The third message that I want to highlight, and for opening this panel, is that the allocation and adequate execution of public budget on health is fundamental to reduce inequality. And according to World Bank data, despite efforts from Latin America to improve its healthcare in the last few years, it still continues below the global average. But this is the total expenditure in healthcare. In most of the studied countries, the half of this investment in healthcare comes from private institutions, including out-of-pocket or institutions that are not part of the administration. Why is this important? And there's another study that FIFARMA has also done with the Y4 Institute from Germany, which proves a correlation between out-of-pocket expenditure and poverty, and it shows figures from the OECD and the World Bank from 2023, where it says that a reduction of 1.7 in out-of-pocket expenses would reduce, rather increase by 1.7% the population that leaves the line of poverty. So this is very relevant. Without further ado, I will now put on the chat the resumes or the information on today's panels. We have Dr. Horacio Toro, Professor Kenji Lopez, and Guillermo Puente with us. And we will have a very quick Q&A session in the next few minutes. Let us start with the general question, which is what is the initial reflection of our panelists on the outcomes of this study and what value do this kind of research contribute at the regional level? Let us start with you, Horacio.
Buenos días, muchísimas gracias por la invitación.
Good morning. Thank you very much for your invitation and warm greetings to all that are joining us today. And I believe that the contribution from this research and the results that have been seen are contributing to the recognition that of the fact that the healthcare is a fundamental factor that promotes human capital and recognizes it as a key factor for the economic and social development of countries. I believe that this document also clearly points out how the key actors in health affect the right to health of people and how they can have an impact on healthcare funding and expenditure. It is also recognized that the financial resources used for healthcare are an investment and are not mere expenditures or loss of profits. It clearly shows the trends in contribution from the private and public sectors to the construction of good healthcare conditions and the guaranteeing of the right to healthcare by people. We have been listening, and it also analyzes the trends in financing of healthcare as an expenditure in each of the countries, showing that each of these countries has its own reality, and that it is hard to establish a one-size-fits-all recipe for all countries. The results show us and urge us to think that the final goal of healthcare systems financing is to achieve universal coverage access, having comprehensive and integrated and equitable healthcare networks around the country, and ensure full quality in healthcare assistance. This is a shared responsibility of the national and the local authorities. And in some countries, like Brazil, for instance, it is the responsibility of the central level, the state level, and particularly the municipal level. The countries with the highest income or the more wealthy countries have the possibility of ensuring a unique healthcare system. It is also understood that the satisfaction of the user with these public services is the guarantee for the model. That is, the greater the satisfaction, the more the use of public services. Otherwise, it induces the search for private services, such as we're seeing a trend in different countries. We can clearly see how the financing systems of healthcare are affected by out-of-pocket expenses, creating an inequality and inequity for the users of the services. We can clearly see the weakening of the public sector also, and the appearance of private insurance programs and plans that make things more expensive. In addition, many public resources support the expense of private plans and programs. In conclusion, this document can serve to orient public healthcare policies and urge corporation bodies to prioritize adequate financing the needs to improve healthcare for our people. This is a first approach on this, on my perspective about this publication. And I want to congratulate the University of São Paulo. I want to congratulate FIFARMA and everyone who has played a role in preparing such an important report. Thank you, Doctor, for your considerations, and for our audience in the chat. You have the degrees or the information about our speakers. Dr. Horacio is a representative of the WHO. Professor Kenji, what are your considerations about this study? Thank you very much, Alejandro, for giving me the floor. First of all, I want to thank you for this invitation. And of course, I also want to congratulate FIFARMA for its efforts and the International Relations Institute of the University of São Paulo. Congratulations. And I want to thank my friend, Janet Ija, for her invitation, for her leadership. And I also want to congratulate Dr. Pedro Ayari for the work and this great executive summary. My initial reflection about this analysis was firstly focused on moving on from the concept of expenditure to that of investment, something that we have recurringly repeated in terms of how we need to address healthcare. This transition needs to be the cornerstone to elevate the social, economic, educational, and foreign investment levels in our region and other countries that under this study. And why do I say this? Because healthcare, considered as an investment and not as a cost, has the possibility of offering differential benefits. And I'm just going to mention some, such as financial stability. Investing in healthcare can provide long-term dividends from life quality improvement. And second, there are also improvements in economic productivity. Healthier persons are more productive. We have better performance in our roles, whether it's in the public or private sector. Third, I was referring to the inequity in the healthcare sectors that can promote inclusive development, particularly for those that are usually lagging. And we see this in countries like my country, these people that are in an informal setting and that have no effective access to healthcare. And finally, I will refer to the socioeconomic benefits. Healthcare systems with high investment levels can contribute to things like literacy, employment, income generation, and local wealth. However, I want to pose a question because this affects different countries. Why is it noticeably clear that governments don't prioritize healthcare, particularly in preventive terms? And from my perspective, and this is just an idea, there are many possible answers. I would say that it's basically because investment in health, particularly in prevention, is not politically visible, profitable even, and its benefits are long-term. And finally, I agree on paying more attention to those diseases or conditions that have a greater impact on healthcare. In Latin America, we talk about cancer as a disease that has over 1.5 million people around the region, and we know that by 2045, more than 2.6 million people will be diagnosed every year. In Mexico, the cost for attending to breast cancer in stage 4 represents almost 3 or 4 times as much as the cost of treating a stage 1 breast cancer. Finally, these are pillars to reducing the amount in healthcare and improving the life expectancy, which is what's most important for us, the life expectancies of those who are suffering from these conditions around the region. Thank you very much. Thank you, Kenji. And something that is very important that I would like to share with the audience, and I would like to invite you to go into the FIFARMA website, where we have the report of the research done with the Y4 Institute, where we identify the impact of the economic burden, socioeconomic burden of diseases around Latin America. The general result is that in 2022, it had an impact on the GDP between 2.3 and 4.7% in conservative scenarios. These are figures that clearly show the impact of healthcare in macroeconomics, and that is why it is important to act upon it. So a very, very good approach, Kenji. Finally, I would like to invite Professor Guillermo Aponte to give us some of his reflections about the study and its contributions to Latin America. Guillermo, go on. Thank you. First of all, I would like to express my thanks to the Executive Director of FIFARMA, Janet Gija, and her predecessor, Carlos Murillo, for supporting our idea of producing this book. Thank you very much, Professor Pedro Dayari, Director of the International Relations Institute of the University of São Paulo, for your trust in me in granting me the opportunity to coordinate this research, and my recognition to Professors Daniel Schettini, Marisa Justina, Daniela Duspoyati, Mariana Shore, Maria Antonieta Flavia Mori, who with their work have made a significant contribution in highlighting the role of healthcare investment. The importance of health is dramatically manifested in the pandemic that has taken the life of millions of people around the region. Only 8% of the global population, 27% of the deaths have been due to COVID. But we must not let our guard down. One of the contributions of this book is that it shows that more than a cost, financial resources destined to the care, prevention, on health are an investment that improves the living conditions of people, optimizes learning capabilities, allows for better life expectancy, and it is an essential condition for the economic growth of countries. An employee who has good health is better using their capacities, skills, and knowledges, which is expressed in a higher labor productivity and the generation of income for the household. This has an impact on the creation of economic surplus and in the growth of the GDP. To achieve equality in access to healthcare services, must eliminate at least the obstacles on coverage, resources, and expenditure. In fact, there is still a significant number of the population that has uncovered health needs. Secondly, there are not sufficient public resources, and we need to minimize the out-of-pocket expenses, as the professor was saying, which are a financial barrier for access to healthcare services, and it is greater the lower the income that is perceived by the vulnerable sectors of the population. This book undoubtedly will help us disseminate the importance of healthcare investment, so that together with the necessary advocacy, the authorities in countries show their political will by assigning more resources for the benefit of the population, and mainly the more vulnerable sectors of the population. Thank you, Alejandro. Thank you, Dr. Guillermo. We're 4 minutes from closing our session. I would like to ask a very quick question, maybe Professor Horacio or Kenji, because we have the results from Mexico, particularly, and Brazil. Any initial reaction or a quick reaction about recommendations that you could issue to the government of Brazil or the incoming Mexican government about how to consider healthcare investment? Thank you, Alejandro. I will talk about Brazil, which I'm very much interested on. As I was in 1987 or 88, a direct actor there, and I had to live through the true health revolution to respond to needs and problems. And after 11 years going back and seeing how this was working, I'm concerned about seeing that in the current study and see that there was an investment. At the beginning, the SUS was thought to provide greater resources because it provided better coverage for the public sector more than the private sector. But now I see from the results of this study that the greater expenditure is taking place through these private plans and programs. Of course, this reflects the dissatisfaction of our users from the loss of quality in the service, the loss of quality in attention, and they try to find some better settings for their health. And I believe that right now, Brazil should, of course, with new characteristics, should go back to this revolution and make the public power on all levels, state level and municipality level, to be co-responsible for improving healthcare financing. I believe, and it has been repeatedly said that we need to fund not only medications or high technology items, but we need to go back to the promotion of health as primary care that is extremely important. Prevention and recovery from disease and ensure high quality public and private systems. In few words, I believe that we have been losing some of the quality, and I believe this is the time to bring back together the central, state, and municipal authorities, but with a strong component of including the active community to work on this issue. This book is guiding us towards that. So thank you very much. Thank you, Alejandro. Thank you, Professor Pedro and Guillermo, who have allowed me to participate in this panel. And I believe that for Latin America, the work that has been done with this research must shed much light and orient public policy and healthcare. Thank you, Dr. Horatio. We are close to finishing our event. One word, 30 seconds with your message for Mexico. 30 seconds. Thank you, Alejandro. Our elect president, Claudia Sheinbaum, is soon to take office as our constitutional president in the country. And she has given us a decalogue to improve healthcare in Mexico. It incorporates concepts of digital security, a free of charge program, a civil service for the healthcare system. But of course, there are challenges such as the high out-of-pocket expenditure, which according to the research center, Fiscal Research Center in Mexico, it's over the 35.8%, whereas in some European countries it's just 12.8%. So what are the recommendations? To strengthen the public healthcare system, eliminating bureaucracies and giving certainty to the entities, particularly with the IMSI and the STAT, which are an answer for most of the population that doesn't have healthcare. So these are just three recommendations. The next one, to achieve the minimum recommended public expenditure for a region, which is 6% of the GDP. Of course, global average is 10%, but I would finish and going back to Pedro Ayari's work, it is about showing political will. Political will is, in my perspective, the empathy from a decision maker about a topic with the capacity of generating an improvement in the service. Thank you very much. Thank you very much, Mr. Kenji. We have come to the end of our forum. Thank you. I will now hand the floor back to Janet. Thank you to all our panelists for their interventions and their points of view on the matter. And Janet, you have the floor to close our session. Thank you, Alejandro. Time is never enough in these webinars. We always are left with the wanting to learn more, to hear more. But let this just be a starting point to continue talking, to continue discussing, to continue acting. I believe that what's magical about this is what each of us can do to improve on this, understanding that everything that we do has an impact even beyond healthcare. And I think that's a very important task ahead. The region has made progress, yes, but the region still has a long path ahead, yes. So that is why we still need to continue working and working together. I don't have much time for conclusions. I had prepared something, but I believe that right now we're just going to close. Please download the studies, both the large, robust study that the university prepared so that you can see all the information, but also the executive summary, where we have some a little bit more digestible information if you're very busy, but both are quite important. I believe that this is the beginning of conversations that we want to continue having. Well, perhaps not the beginning, because we have been talking about this a lot, but let this be the opportunity to resume this and to give more energy into it, to infuse more energy and fuel into something that undoubtedly requires the work of us all. Thank you to our panelists, our speakers, the University of São Paulo. Infinite thanks for believing in this initiative and for putting so much energy into these studies that we're creating and that we're working on at FIFARMA with such great institutions as the University of São Paulo. Thank you very much. And have a great day, everyone.
Buenos días, muchas gracias.
Thank you. Have a good day.